Om Dhanvantraya Nama.
Namaste.
Good afternoon to all. Myself, Dr. Ravindra Varma, Professor and HOD, Shri Babu Singh Ayurvedic Medical College, Farrukhabad. It gives me immense pleasure to introduce to our today's eminent guest speaker, Dr. Vijaya Sorganvi ma'am. Dr. Vijaya Sorganvi ma'am is presently working as an assistant professor in the Department of Statistics from the Medicine BLD University, Vijapur, Karnataka. Ma'am has completed PhD from Dharwad University in 2017. Madam has published more than 7 papers in national and international journals. Madam has also presented 11 papers in national and international conferences. Madam has conducted many SPSS hands-on training for various students of UG, PG and PhD students at various colleges in India. Madam was also a resource person for many national and international seminars. Madam has delivered many guest lectures in various colleges on statistics. Madam is also a member of Indian Society for Medical Statistics, New Delhi. With this short introduction, I request Dr. Vijaya Sorganvi ma'am to start the session. Thank you.
Thank you. Thank you. Thank you. Okay. Good afternoon, everybody. Madam, may
Yes,
I audible, madam?
Yes, madam, you are audible, ma'am.
Okay. So today we are discussing about how to calculate sample size. Actually, it is a vast subject. We know study design, different types of study designs we have. Calculation for each type of study design, discussing in limited time is very difficult. That's why today in this webinar, we are discussing how to calculate sample size for cross-sectional studies. Because usually as a PG in medical professionals and other than that, we usually adopt cross-sectional studies. So in this webinar, we are going to discuss about calculation of sample size using manually formula and using online software. Okay. So I must thankful to Shri Babu Singh Ayurvedic Medical College and Hospital, and for giving the opportunity to share my things with all the students. And I extend my thanks to Madam Sarita, Dr. Sarita, for inviting me as a resource person for this webinar. And also I am very much thankful to all the participants of this webinar. So without wasting much time, I will start about calculation of sample size. So the aim of this webinar is to make confident among healthcare professionals and others also for sample size calculation in different situations. So at the end of the webinar, I hope we can solve sample size in different situations using software or using manual formulas. Because in this workshop, we are hands-on training. We solve some examples using both methods, as well as I give some exercise to solve you. So you will be perfect in calculation of sample size. Because when we do it, unless and until we calculate, we can't be perfect in that, because how many times I repeat it, or I mean, you may hear from many resource persons is you might have read books, but it will not get into head unless we solve examples ourselves. Okay, so we have to take some examples and we try to solve with using softwares or manually also. Then only we can understand it very clearly. Okay, so first question arises, why sample size is required to calculate? If I have source, I have budget, why can I include all the patients with visiting to my clinic? Why to calculate this sample size? There is a question for you. This is the situation. In a college canteen, a researcher randomly selected 5 students, asked whether they drink tea daily. So he included 5 students. Out of 5 students, 3 said yes. So researcher, whether he can interpret that 60% of the students in the college drink tea daily. Answers may be in yes or no. Can you give answer? Or you type in the dialog box. Answer is no. With small sample, 5 students, he inquire about the consuming tea in his canteen. So even though 60% are drinking out of 5, but he cannot interpret the result. So you see this example, same statement. In a college canteen, a researcher randomly selected 50 students and asked whether they drink tea daily. So out of 50 students, 20 said yes. So can he interpret that 40% of students take daily tea in his canteen? Give answer in the chat box. Here you can give 3 options are there. Yes, maybe, and no. So answer is maybe, because out of many students, college means will get usually more than 500, 600 students, even in thousands. So he selected randomly only 50 students, and with 40% proportion of drinking tea in his college, he cannot say no, but maybe, or answer maybe 2, like maybe and yes. Okay. See this statement. A researcher selected 300 students. Out of 300 students, when they ask whether they take tea daily, 300 out of 300, 50 students or 150 students said yes. Okay, what is the, can he interpret that 40% of students in the college drink tea daily? Answers are no and yes. So answer is here, yes, because he has taken large sample, and in that 40%, whatever be the proportion of taking tea, that only he is going to test. But he has taken large number of subjects in his study. So this conclude that when our sample size increases, the level of certainty will be increased. So when we have taken only 5 students, our answer, we cannot represent that result or we cannot generalize that results. So when he increases little bit, maybe or yes, he can interpret or may he interpret. When we increase the sample size to 300, definitely he can interpret his results and he can generalize data to results of that study to general population or total population. So sample size increase means our certainty, level of certainty will be increased. Then sample size increase means when we say that it is increase or it is decrease, or we can say it is small or large sample. So two scenarios are there. One is small sample, another is large sample. When we include very small sample, we may declare clinically significant difference as insignificant. Means we do experiments or we collect the data, we observe the data, and we have seen that clinically there is a significant difference between two groups or more than two groups. But when we apply statistical test and our result is insignificant. Why? Because of small sample. Okay. So small samples lead to wrong conclusion. Okay. Other hand, if we include large sample, then we may declare clinically insignificant difference as highly significant. Because actually when we see the results, we observe only difference is very less between two groups, like 2 or 3 difference is there. But when we apply statistical test, we get highly significant difference with confidence level 99%, P is equal to 0.000 or 0.001 because of large sample. So when we take very small sample or when we take very, very large sample, chances of drawing wrong conclusion is there. Okay. So whatever the extra we take in a large sample, subjects in a study, that is waste. Because we spend more time to collect the data, and it is budget-wise also it will be more, but drawing conclusion sometimes is wrong. Okay, so it should not be too small or it should not be too large. It should be optimum sample size for that research. Correct sample size should be included for our research. Then we may think that whether we can include all the patients in a research. Yes, we can include, but when we have very small size in the population, here population means not only group of the people, study elements. When we do experiment or when we do research on animals of that type, means which animal we include in our research, like frog or cockroach, rats, that is our population. Okay, study subject is called population. So when population size is very small, we can include all the subjects in the study. Okay, so when it is large, like diabetic patients, hypertensive patients, school-going children, they are large in number. So we cannot include all the numbers, all the subjects of population in the study. So we may draw wrong conclusion. It is waste of time, consumes more time as well as more money if we are investing money on that research. Okay. So usually we take sample study for our study, for research. Okay. So sample size depends upon size of the population. So if size of the population is very large, we go for sample study. When it is very small, we take all subjects of the population without calculating the sample size, because we are not including the sample means there is no question of calculating the size for the sample. So, but usually we not carry out the study on whole population. We take a sample, because when we do some drug trial on the patients, so new drug is there, we don't know its side effects, we don't know its bad effects. So how can we give that new treatment applied to all the population? Is it? So better we have to take sample and you try on that, and then if effect is good, then we can take more samples and we can do, we prove that that medicine is effective, that treatment is effective. So usually we take samples for our study. And then that selected sample should be representative from the population. Representative sample of that population it should. Here representative means it should contain all types of varieties of data subjects in the sample. Like suppose our study is related to socioeconomic classes. We are taking school-going students, including in a research. So if I go to private schools with many facilities they have, there usually we get class 1, class 2 students, economically belong students we get. So they are not representative sample. Whatever conclusion we draw, our result we draw, that applies to only that type of population, means to that class 1, class 2 students. Okay. So instead of that, if we collect few from private schools and few from government schools, so all type of population, all socioeconomic groups of population, students, we will get in that study. Okay, so that is called representative sample. So to get representative sample in statistics, we have tools called sampling methods. We apply sampling methods in different situations. We use different methods while drawing samples from the large population. So we get representative sample when we adopt sampling methods. Okay. So that is a different thing. We are discussing only about sample size calculation. Okay, we'll go to next slide. As we know, there are different study designs in the research, mainly observational studies and experimental studies. So these two are the main classification of the study designs, observational and experimental. In observational studies, again, we have descriptive and analytical study. In experimental study, again, we have different studies, RCTs, comparative study, cohort study. So different types of studies are there in experimental also, but we are discussing sample size calculation only for cross-sectional studies. So I concentrate only on observational studies. Okay, so they classified as a descriptive and analytical study. In descriptive study, we have case reports and case series. That is one type. And another type of descriptive study is cross-sectional. Similarly, in analytical study also, we have cross-sectional and case control. Okay. Coming to descriptive study, First one is case report and case series. So this we do when we have rare type of subject we see, means rare disease population. If it is only one case, a rare case, then we observe and we record all the observations, what we see in that case, that we record and we report it. That is called case report. And case series means that rare case, if we get more than one, like 2 cases, 3 cases, or 5 cases, and again we observe and what is happening in that we report, that is called case series. Okay. So here no need to calculate the sample size, because case report means it is only one case. Case series means we get similar type of cases, only very less number of number in. Okay, so like 3, 4, 5 cases, that is called case series. So there we will not calculate the sample size. The second type of descriptive study is cross-sectional. In descriptive cross-sectional study, we do survey, but we will not prove anything in that. Okay. So just we observe, or just we want to find incidence or prevalence of particular disease, or say we want to test knowledge, attitude, and practice about some topic. So we survey, and whatever we get results, we analyze, and what we get result, that we write. Okay, that is, we prepare the report of that. So that is cross-sectional, descriptive cross-sectional studies. Then coming to analytical study. Analytical study means we assume hypothesis. Here also we have cross-sectional and case control study. In cross-sectional study, we assume hypothesis, like we get one outcome and we find what are the risk factors or associated factors for that outcome, observed outcome. Okay, so we assume hypothesis and we find the risk factors, associated factors for that outcome. So that is called cross-sectional studies. Then coming to case control study. This is also hypothetical studies. We assume a hypothesis and we compare cases with controls. That is observational, analytical, case control study. So these are how to calculate for cross-sectional descriptive and cross and case control studies in analytical study, how to calculate sample size, and that we are going to discuss. So in cross-sectional studies, we select sample or samples from the population and we calculate, we estimate the variables like prevalence, incidence only once and at the same period. We will not visit same population, same subject, same patient many times. Okay, one time we collect data. That is called cross-sectional study. You may ask, sometimes today in the OPD, only 10 cases visited, we collect information. Tomorrow again 10 cases will come. Okay, that is also cross-sectional. We have not collected information repeatedly from the same population, same patients. Okay, that is cross-sectional study. Today, tomorrow, or 1 month, we collect from information from different population. So that is not prospective study. That is cross-sectional study. We collect data only one time from the subjects, is a cross-sectional study. Then coming to calculation of sample size. Now we have to follow some steps when we calculate the sample size. They are, first one is identify the major variable. Means what is the major, because when we see the article, published article, previous articles, we will get different variables, like including demographic variables, different variables we collect. Okay, we have to identify the important or major variable related to my objective or aim of the study that we have to identify from the article. Then review the literature. So we have to study similar study, we have to find out and we have to review them. So we get knowledge that how to do. Along with that, what is the main outcome, what should be, which parameter should be take to calculate sample size. Okay, so it is also very important step. Then set the parameters for sample size. So after getting the variable, major variable, by reviewing the literatures, we set the parameters. Means one, we select from the previous studies, we select major parameter to calculate the sample size. Second parameters means we have to decide confidence level, margin of error, power of the study, all these things we have to assume. Okay, so these parameters we set before while calculating the sample size. So then after getting major parameter and setting confidence level and power decision, margin of error, we calculate sample size either by using formula or using online softwares or paid softwares. Okay, so after calculating sample size, if we are not satisfied with that sample size, we can change, we can increase or we can decrease by doing some adjustments. This is optional. When actually after calculating sample size using formula or software, that is our final sample size. But we do some adjustments if required to increase or to change the sample size. Okay, so they are mainly effect size. You might have heard effect size and response rate, non-response rate, and many 2-3 adjustments are there. That is finite population. If we know the frame of the population, we can do finite population to increase the sample size. Okay, so we do some adjustments, and last step is write-up. So it is very important that write-up of the sample size. When PGs or researchers come to statisticians, we calculate their sample size. If we tell them that your sample size is 200 per group, that's not enough. We have to write how we got it, what assumptions, what confidence interval, what margin of error, and what parameter we have taken from the previous study. Everything we have to mention in that statement. Okay, so we cannot write sample size after calculation, I got 200 per. No, what assumption we made, everything should be written. Okay, so this is also very important step in the calculation of sample size. So we have to follow all these steps when we calculate the sample size. So this is in detail discussion of each step. We have totally 6 steps. 6 steps we are discussing in detail with examples. sorry. So step 1 is selecting the major variables. So suppose variable in research or our aim, our studies on blood pressure. So we'll search the article. In that article, if systolic BP, mean systolic BP they have given. So means continuous data is there, mean value and standard deviation is there. We use mean and standard deviation to calculate the sample size. In some research studies, researchers make the continuous data into categorical, like they classify them as how many are normal, how many are low, and how many are high systolic blood pressure. So they categorize it, they classify. So if classified data result is there in the previous study, we use proportions to calculate the sample size. Okay, so it depends what we get in the studies, previous studies. Okay. Then coming to second, suppose our study is on about blood sugar. Suppose fasting glucose mean and standard deviation is there. We use those variables to calculate the sample size. Okay. If they classified again them to categorical data as non-diabetic and diabetic, we have to use again proportion sample size. Okay. Formulas are different for categorical data and continuous. Using proportion, that is nothing but percentages, and using mean values. Then if sleep duration is there, hours of sleep in mean and SD is there, we use mean formula. Otherwise, if they have classified as adequate sleep and inadequate, categorized them, we use proportion sample size. Exam results, marks, if they have given, we use mean formula. If they classified as pass and fail, again percentages we will get. So formula we use is proportion. Using proportion, we calculate the sample size. So coming to second step, review of literature. So we search similar studies, that is review of literatures for getting the what important parameter. If similar studies are not there, so what to do to calculate sample size? We do a pilot study, including 10 or 20 subjects, 20 cases, we do a pilot study. Okay. So if we include 15 cases in the pilot study, we decide number of samples, number of subjects as 10, between 10 to 20, or we fix period for pilot survey, like 15 days, 1 month. Okay. So in that period, number of cases visited to a hospital, that only we include for pilot study. Okay. So we calculate, we analyze that data, we analyze important parameter data, and we get proportion or mean value. Using that, we calculate the sample size. Okay, so doing pilot study have many benefits. One is it is used to calculate the sample size if similar studies are not there, if our study is a new study, and we can check whether full information we get by our prepared questionnaire. Okay, what information is required that we collect, no, that is called questionnaire. We prepare a questions based on our aim and objectives, what information is required for my study. So that questionnaire give all the information which are required, that we can check by pilot study. So we can edit the questionnaire. Okay. And we can check the reliability of the questionnaire. Okay. So whether it is related to my topic or not. That we can check by using statistical tools called reliability of the questionnaire. Okay. So sometimes if it is also not possible, means rare disease is there, one case per month is coming. Now we are submitting our proposal to university, or sometimes we are applying for grants. Time is not there to submit, short period is there, or for ICMR project, we are taking the project, funded project. So if there is no time, if it is not possible to do pilot survey, then we can assume with our experience, we can assume the parameter from the previous, means the previous year, how many cases have visited. So based on assumption, our experience, we calculate the sample size. So this is about review of literature. Then third step, set the parameters for hypothesis testing. Okay, so we have to fix while calculating sample size, that confidence interval or power and margin of error. These things we have to decide while calculating. Okay, so when that they are called type 1 error and type 2 error, is nothing but power and Z alpha value. That is type 1 error. Okay, so when when actually we should accept the null hypothesis, we reject it. Statistically, by applying test, we reject it. That is called type 1 error. That is Z alpha. And when type 2 error means when we have to reject it, we accept it. Okay, when we should reject the null hypothesis, we accept it. That is called type 2 error. That is also called beta error. Z beta we call it. Okay, so by increasing the power in the study, we minimize the type 2 error, because type 2 error is a very serious error. So first, by increasing power in the study, usually we take 80% power in the study. By increasing it, we can reduce the type 2 error in the study. So correctly, we can draw the conclusion. So to draw correct conclusion at the end of the research, while analyzing or after analyzing the data, to get correct result, we assume we take type 1 error and type 2 error, power and alpha while calculating sample size. Okay, so you might have seen Z alpha plus Z beta into standard deviation divided by mean difference. This is the formula we use to compare two groups, to calculate the sample size for two groups. Okay, so we consider there Z alpha minimum 95% and Z beta, that is power minimum 80%. So if we consider minimum 95% level of significance and 80% power, definitely we draw correct conclusion. Means when clinically there is difference, statistically also we say there is a difference. Or when clinically there is no significant difference between two groups, by applying statistical tools, we draw conclusion that same conclusion we get. Okay, so that's why while calculating sample size, we consider power and level of significance. If we consider 95% confidence level, means we are taking only 5% error in that, because we are doing sample study, not population study. So it means we may get 5% difference from sample to population when we generalize the result of sample to population. But 95% our results will apply to the population, that particular population. Okay, so that we consider Z alpha and Z beta while calculating sample size to draw correct conclusion at the end of the study. Okay. So this is setting the parameters while calculating sample size. Fourth step is calculate sample size using formula, using software or mobile apps, or using online calculator. We calculate the sample size. So fifth step is adjustments. Okay. So if we're not satisfied with calculated sample size by using any of these four, we adjust it to increase or to decrease the sample size. So for type 1 error, Z alpha, we have to consider from 5% to 1%. We may take 1%, we may take 2, 3, 4, or up to 5%. Okay, error only we are considering from 1 to 5%. I cannot consider 20% as a type 1 error. If 20% means 80% level of confidence is there, means my sample result will apply only 80% of the population. 20% we can't give guarantee. So 5% error is acceptable. So we consider from 1 to 5%. So first, if we consider 1%, our sample size usually large. So we increase it to 2 or 3 or 4 up to 5. And beta error, type 2 error, 5% to 20% we consider. Means minimum 80% power should be there. Error we are considering 20%. Power, precision 80% we consider in the study. So these are the common assumptions we make while calculating the sample size. Then with formula, we calculate sample size. If we want to increase or decrease, we do some adjustments. If required, they are finite population. If we know total population visits or total population of that frame, we can use this finite population. With finite population, we can decrease our sample size. Then second one is design effect. By considering design effect, we can increase or decrease the sample size. Then response rate, we adjust the sample size. So for finite population, adjusting sample size with finite population means usually when we calculate with infinite population. Okay, while we calculate using formula or software, we consider infinite population. But if we know, wrongly I have this typo mistake is there, it is infinite population. We consider infinite population and we calculate using formula or on software, we calculate the sample size. If we know total size of the population, we can adjust it using that finite population. Infinite means usually software will consider 1,000 to 10,000 population. If we know there are only 500 total population is there in that source, so using changing that infinite population to 500, we can decrease our sample size. Okay, so that is called adjustment for finite population. So this correction reduces our sample size. But if sampling frame means total sample is only 100, if we know that total availability or 100 subjects are there, then we calculate with the assumptions of infinite only. We will not make any correction, finite population correction in that sample size calculation. So if then last one is considering response rate or non-response rate. So it is depending upon the researcher wish. He consider or she consider while doing research. Suppose while collecting the data, if some population have not given full information, missing data are there, or when we do survey, that house is locked. So these things may happen. So they add 5% or 10% up to 20% of the calculated sample size to the calculated sample size. Suppose 200 is the calculated sample size. They add 10% of that is 20. So 200 plus 20, 220 is our final sample size. So some are, while giving information, if mistakes are there, missing observations are there, some availability is not there. So we take more 5 to 20%, we add to them, and that much we collect. And we can delete if missing are there, if non-availability is there, we'll not bother about that. Anyway, we added more participants in that. So we will not bother about a missing observation. So it increases the sample size than calculated one. That is response rate. So design effect. When you are selecting the subject for study at cluster or group level, we do the design effect. Means for one group study, we will not consider the design effect. When we take clusters, means different groups in a study, there we use design effect. Design effect D is 1 plus M minus 1 into rho. M is number of individuals per cluster, per group, how many sample size we are taking. That is M, small m it is. Rho, value of intra-correlation, means if in the previous study, correlation value is there, that we take correlation coefficient value, or with expert assumption, we consider the correlation between the variables. We consider it and we calculate the sample size with design effect. Usually in software, design effect is by default, it will be 2. If you want to change, if in the previous articles we got it as 1.2, instead of D2, we change it to 1.2. This is design effect we apply when we include more than one group for the study. So when we calculate sample size, 3 important things we should remember, we should understand. They are which formula should be used to calculate the sample size, because we have many formulas depending upon the study design. Then input needed for the calculation for the formula. If I am doing online software or I am using with manual formula, what should be the 95 confidence interval, power, margin of error, that inputs should be decided before only. Then how to write up the calculated sample size. So these 3 things we have to remember while calculating the sample size. So we have in observational studies, mainly we have 4 formulas. If we are doing study including only single group, one group study is there, finding incidence or prevalence, that is called single proportion. Using categorical data is there. We expected proportions we take from the previous study we take confidence interval and precision in the study, that is margin of error. We decide and we calculate the sample size using that particular formula that we are going to discuss. Then single mean, if our study is quantitative type of study, we have continuous data like marks or systolic blood pressure, diastolic or blood sugar values. So if our study is continuous, means quantitative type of study, we get from the study standard deviation. Using that standard deviation and assuming the confidence interval as well as precision, we calculate the sample size. When it is observational analytical study, we compare two proportions, means qualitative type of study is there, then we calculate proportion difference, or if odds ratio instead of proportions, if we have odds ratio, at least for one group is there in the previous article, we can use odds ratio as well as proportion of one group to calculate the sample size. Here also alpha error, that's confidence interval, and power we have to assume in the study. So here we will not take margin of error. If it is single group study, we take margin of error in the denominator. If it is analytical comparative study, in the denominator, we take difference between main parameter. If we have proportions, we take difference between two proportions in the denominator. If we are doing using mean values, we take difference of two means in the denominator. Okay. So this is what we have to take from the previous study, and what we have to assume for assumptions to calculate the sample size for different type of cross-sectional studies. So now we'll discuss first one, sample size calculation for one group using proportion. Okay, this is the formula we use. You might have seen N is equal to Z square. Z is confidence level. Usually we consider 95%, and for 95% we have fixed values as one Z value is 1.96. Sometimes we say 4P into Q. 4 is round up of 1.96. Okay, so 1.96 square or 2 square we can take into proportion value into 1 minus P is Q, means negative character. Okay, P is expected percentage of parameter of interest. Suppose we are selected from the previous article, incidence of the some particular disease. That is our P value. With that P value, we calculate sample size for future step. Okay, then D denominator is margin of error. Okay. So usually we consider 1%, 2%, 3%, 4%, or 5%. Again, in margin of error, we have two types. When we use this software, it will ask which margin of error we select. One is absolute error, second is relative error. So we'll again discuss this later. So what is input needed for sample size calculation for one group using proportion value? One is expected proportion from the previous article. We have to say take margin of error, whether 1%, 2%, or 5%, that we have to decide. Then calculate the sample size. Okay, level of confidence, expected proportion, and margin of error are must to calculate the sample size. So population size, that is infinite population or finite population adjustment, we do know for increasing or decreasing the sample size. That one, design effect and response rate, that is optional. Okay, so these first three things are must to calculate the sample size, and next three are optional. If you want to change the sample size, we adopt all three adjustments. So this is the group of population. We have 5,000 population in the group. So our population contains 5,000. Wish to find the prevalence of hypertension among 5,000 population. So n is equal to 5,000. We are drawing 200 from the 5,000 population. So our calculated sample size is 200. Then suppose 48 are hypertensives out of 200. Out of 200 from sample we see. We will not see from the out of the population value. Then proportion of hypertension is 48 into 100 divided by 200. So how to calculate proportion? We have 200 patients in a group, and when we survey, when we ask them about hypertensive, out of 248 are hypertensive patients. So P1 is P is equal to 48 into 100 divided by 200. So out of 200, 48 are hypertensive. So for 100, we convert it to percentage and we use that percentage P value to calculate the sample size. This is how we calculate P value proportion. Now in this problem, it is 24%. Then 1 minus P or 100 minus P is 100 minus 24. Okay, that is our. Then 95% CI also we get. That is in this study, when we calculate using this proportion value, we can calculate the confidence, 95% confidence interval or 98% or 99%. So if we calculate 95% of the confidence interval, it is 18.2 to 30.5. Okay. Means what? It implies when we do study from the same population, hundred times, means when 200 sample size we draw from the same 5,000 population, 100 samples we draw, different samples we draw, we calculate proportion. This 100 study revealed proportion between 18.2 to 30.5. Okay, that is called, it is a range. It is a lower to upper value of the proportions. We get 95% of the confidence level. Okay. Now, we'll calculate sample size. So for using single proportion, from article, we get a proportion, prevalence and risk factors of hypertension in urban adults. This is the example, a cross-sectional study. So title of the study, previous study is prevalence and risk, or our present study is prevalence and risk factors of the hypertension in the urban adults. So our research objective is to explore the prevalence of hypertension with its socio-demographic determinants, association of the risk factors. Okay. So what is the selection unit here? Hypertensive patient. Okay. So this is the example, cross-sectional study with prevalence and risk factors of the hypertension among urban adults. Okay. So from the previous study, estimated prevalence is 25%. Okay. So we selected it from the previous article. Desired confidence level, minimum it should be 95%. So we consider 95% only. So Z value, corresponding Z value for 95% confidence value is 1.96. Margin of error, upper limit only we consider as a 5%. So formula is Z square into P into Q, or P into 1 minus P, or 100 minus P upon D square. So substitute the values. Z is 1.96, prevalence is 1.25, and 1 minus P is 1 minus 0.25, and d square out of 1 probability it is 0.05. Okay, with 100%, we say that 5%. So if we consider total as 1, our d square is 0.05. So simplify this, our sample size is 288.2. To take round figure, we consider it as 289. So sample size, this is using formula we calculated. So same thing can be calculated using online software. So I think all of you have laptop. If laptop is not there, you use mobile also. Smartphone should be there. So we consider confidence level as 95%. Proportion from the previous study got is 25%. And we decided to take margin of error as 5%. How to calculate that I will show you. So this is a Statulator software. Okay. So you go to Google search, type there Statulator. Statulator. Okay. So I confirmed it whether you opened it or not. So you click on sample size. This is a drop-down menu. So click on that. Here we have main two options, using proportion and using means. Okay. So proportions and means, two options we use in the cross-sectional study, we use proportions or means. Okay. Again, in proportions and means, we have three options. First one is estimate a single proportion. Means our study is qualitative type, yes, no, present, absent, like that, prevalence incidence study. So this is for one group, we use this, estimate a single proportion. Then for comparison of two proportions to compare two groups, we use compare two independent proportions. And third option is compare paired proportions. Means a paired study means we take only one group, but our results are before and after. Usually, studies related to Ayurvedic medicines, they take data or information from the patients in different period of time, before treatment, after treatment, after 24 hours, 2 days, like that. So that is called paired data. To compare before and after, we use compare paired proportion. If our previous result or study have paired data, means proportions before and after, so we use this form. Similarly, in the second option for quantitative type of study, estimate mean means for one group, for two independent groups. Okay, not before and after. Two independent study group and control group, like that. Then compare pair difference. So before and after, systolic BP before and after, to check whether difference is there after treatment, whether it reduced the high BP or not. We use paired analysis. No? So if we have from the previous study, two means before and after, we use along with standard deviation, we use that this formula of comparative of pair differences. Okay, now we are solving example on estimate a single proportion. Okay, so we use this one. Okay, now we are there on the calculator mode. We selected proportion, single proportion. By default, this is level of confidence. Okay, this is level of confidence. If you click on this mark, what is confidence level, that description is there. Okay, so now we considered 95% as a 95% confidence. interval. If you want to change it to 99%, it will move left side and right side. So your mouse, you have to click the left side, you have to click on that and move it to right side, or you can move it to left side. Okay. So minimum 95% should be there. By default, it will be 95%. If you want to increase, you can increase it like this. Okay. So now 95% confidence interval. Then expected proportion. So if it is 50%, 24%, that proportion we will get from the previous studies. Now, in the present, we are taking 25%. So here it is 5% in my statulator. You see how much it is there. Again, click on that, press on that with the left mouse and drag to left side up to get 0.25. Okay, now I adjusted it for 0.25. Now level of confidence is 95%. Expected proportion is 0.25. And coming to last one, again, precision or margin of error is there. Its meaning is also there in the mark. If you click, you will get it. Now, you see this. Here, we have again drop down menu is there. Now, default absolute precision is there. If you click on that, you will get relative to expected proportion also will get. So now we will consider only absolute value with 0.05. If you can, default will get 0.05 means 5% margin of error. You can increase it like 6%, 7%, or you can decrease to 1%. Okay. So now we considered 5%. So I kept it to 0.05. So calculate. So what is your sample size? With 25% proportion, 95% confidence level, and 5% margin of error, our calculated sample size is 289, or we can take 290. So this statulator online software is a good software to calculate sample size because it gives references and also it gives description about that sample size. What is written here? Assuming that 25% of the subjects in the population means our, what is that? Proportion is 25%. Have the factor of interest. What is the factor of interest? We are finding, here we can change it. You write, assuming 25% of the proportion in the population, the factor of interest is, suppose we are finding proportion of mortality by COVID. So we write here proportion of mortality of the COVID. The study would require a sample size of 289 for estimating the expected proportion for future study with 5% absolute precision and 95% confidence level. Okay, so it gives this description also. So I told you write-up is very important while discussing the steps we have to follow while calculating the sample size. Excuse me. So this gives that description also. Only thing, few factors we have to change here. What proportion we consider from the study, that should be there. Factor of interest means what variable parameter we have taken from the previous study, whether it is incidence, prevalence, mortality rate, or sleep duration, that we have to change and write. So sample size is 289. What we considered that it gives with 5% absolute precision, whether we took absolute precision or relative precision, that also it mentions, and with what confidence level we considered that. So if you change it to 99%, just you change it to 98%, your sample size will be double. In some researches, when prevalence is in decimal points like 0.0, 0.01, 0.2, like that, we get sample size as 2, 3. So in that case, we increase this confidence level up to 99%. So our sample size will be double. And even after increasing level of confidence, if our sample size calculated is small only, then you change it to relative expected proportion. So it will be more larger sample size we will get. Okay. So in that case, again, you can increase level of confidence. Okay. So that relative measure to absolute measure. Okay. So this is how we calculate sample size for one group of qualitative type of study. I think I'm clear. So you again practice this by taking different studies, and you will get. Okay. You keep on practice it. Otherwise, you may forget the assumptions what we have to take. Okay. Now we'll coming to slide. Okay, next is, if I want to adjust with finite population or with the design effect or response rate. Okay. So I can do it with the same software. Okay. Okay, level of confidence, what we considered is 95, expected proportion is 25%, margin of error is 5%. If I want to adjust the sample size for decreasing, if I consider finite population as 500. Okay. So adjustment I am doing with finite population. So go to that software. Okay. So here adjust is there. After calculate option, adjust is there. Click on that. Okay. So we have all three types of adjustments. Okay. Adjust for finite population is there. For clustering means design effect for comparative study is there. And for response rate also there. Okay. So now we are adjusting it for finite population. So click on that. So by default, it will be 1000. So you changing it for finite population 500. You can type here 500, or you can decrease or increase this option. So update. Previously it was 1000. No, we have to update it. Your sample size has reduced to half. 200 something was there. No, so almost half sample size reduced. Okay. So if we know total sample, total population size, then only we can do it. Okay. So before going to slide, I show you how to adjust other adjustment methods. So this is not cluster study. So this I will remove. I will adjust for response rate. Okay. By default, it is 6%. If you want to take 15%, 15% response rate means 85% response rate. Non-response rate means 15%. So update it, your sample size increased. Okay. Here I took 6%. No? So absolute precision is 5%. So sample size was some number was there, but it has, when we added, we got it as 2007. Means non-response rate means missing observations, half information or log of house. So in that case, if we consider 20% or 15% more in calculation of sample size only, if you want to add, we can do this adjustment using statute. Okay, so again, I will delete it and update it. Okay, so this is how we calculate sample size using that. If you have any doubts, you can unmute and ask, or at the end of the session also you can ask. Or if you have now only, if you have any doubts regarding the software, you can ask. It has increased to 406 because I increased its confidence level to 98%. If I take it as 95%, it will be 289. So for this, if I add 15% means 15% of 289, or 20% if I add, or 10%. 10% of this is 28.9 or 29. So 289 plus 30 population I will add to the calculated sample size for adjustment for non-response. Okay. So I'm telling you frequently, if you get any doubts regarding this, you unmute it and ask me now only. I try to clear it. Okay. Now,
Ma'am, settings are changed, ma'am. Participants can
Hello?
unmute themselves and they can raise the questions, ma'am.
Pardon, madam.
Now the setting has been changed, ma'am. Previously, it was unable to mute from the participant side, ma'am.
Okay, okay.
Now they can unmute themselves and they can directly ask questions to you, ma'am.
Okay, okay. So that I'm also requesting that only. So,
can you please add more some difference about the difference in confidence interval and power?
Confidence level means actually precision is a power. Okay, precision of the study increases by increasing the power in the study. Okay, sir. And confidence interval means we consider the error. Why? Because we are doing sample study. 100% result, we can't say our result will apply 100% to the population when generalizing the result. Is it? Suppose population has 5,000 population, we are taking only 500 from that. Whatever result we draw from that sample, we generalize to again 5,000 population, that particular population. So while generalizing, we consider some error, that is 5%. That is called level of. Confidently, I can say that with 290 sample size, if I do a study, my result will apply to population minimum 95%. That is my confidence. I say confidently,
yes, I got it. But is it dependent on randomization or it is independent of random?
Randomization? No, randomization is different. Randomization comes when we allowed the, when we recruit the samples to different groups. Is it?
Okay, okay. But about choosing the
while choosing samples to different groups.
Yeah, but if I'm as you publicized in that means that was the example about the that circle. But if you are choosing again from the one quadrant of that circle, how we can say that it is applicable to the? How can we generalize it with that confidence here?
Sir, pardon, sir.
Yeah, but if we are saying we have 95% confidence, we have to take samples from the whole population.
Yeah.
But does it necessarily it should be taken from the whole population or part of that population?
From the population only we draw, no, sir?
Okay, but how?
Suppose in a school, in a class 5th to 8th, we are taking school-going children's. Is it, sir? So total population we will come to know there.
Yeah, but if anyone is taking just from single class and the number is filling and he is saying just I am having this number and I am having 1,000 population, I am taking 2,200 and I am having 95% level of confidence. Then what is the difference between taking from all the standards and from taking from only one standard?
All the samples or only one sample, sir? All the population or one sample?
Yes, from all the samples, all the population. That means
All the
standard
population.
one,
So,
standard one, standard two, standard three.
yeah. Sir, if we take whole population of a school, we have decided to take from 5th to 7th. Is it? Higher primary school we are including.
Okay.
So if I include all the students from 5th to 7th in my study, it is a large sample. Apart from these drawbacks like the consumption of time, consumption of money, we draw wrong conclusion because bias will be more, sir. While collecting the data, while giving the response, bias will be more. So when we want to, means conclusion may wrong. Previously, I have shown some.
Madam, I'm getting it, but can you please share some, throw some light on that power?
Sir?
Power subject.
Power subject. Power we usually we use while calculating sample size for more than one group, sir. We saw one example on that also. I will show how to consider power because here it is there is no option because it is single group study. So we consider only margin of error and confidence levels. So power we will not consider for single group study.
Okay, thank you. Thank you.
Ma'am?
Huh.
Ma'am, is there any limitation for this sample size? I mean, the population is limited, or we can take unlimited population in this? Means
if you know some population value, if you know population value, we can adjust for that.
we can take infinite number of study, the population size in this to calculate the sample
size. So that
size.
formula itself is for infinite population only. What formula we use, no? That is for infinite. Okay.
So ma'am, the software margin of error in infinite population will be how then? The error will be more, na? If you are taking infinite population.
No. It is not margin of error. Margin of error is only up to 5% we consider. That is different.
Okay.
This is adjustment with little bit formula will change. Adjustment with what? Finite population. Formula is different. Means and when we use calculate.
This calculator cannot be used.
No, I have shown, no?
Yes.
This adjust is there, no? Option is there, no? Adjust. Go to there.
Yes.
You have these for finite population means you will change the infinite population to, by drawback, it will be 1,000, no? So means it is considered, software has to give one population size, no? It takes, statulators take 1,000, okay? But
yes,
when you calculate manually, that is for infinite samples, so for infinite population size only. I have some slides about that also. I will show you.
Okay, ma'am. Thank you, ma'am.
We'll continue, madam. I will
yes,
go to.
Yes, ma'am.
So this is adjustment with finite population as well as with not design effect, because the design effect will come for the comparative studies. For response rate, I have shown in the statulator. So after calculation of sample size using formula, Z square into P into 1 minus P divided by D square. If you want manually, if you want to do the finite population size for 500, this is the formula, madam. You were asking, no? So that calculated sample size using formula, what we got 289, no, that is considering the infinite population. So now you are adjusting for finite population when you know the total population size. This is the formula we use to adjust for 500 population instead of infinite. Okay, N naught is 289. That is calculated sample size. Other 1 plus N naught minus 1 by 100. This is denominator, and 289 by divided by this give us sample size with finite population 500. Is it clear? I think it is clear to you. We'll go
Yes,
to next.
ma'am. Yes, ma'am. Thank you, ma'am.
So this is, I solved that example. It has reduced to 184. In software also, we got 184. Okay. Okay, next is, we'll try one example. This is the scenario. Estimate prevalence. This is for design effect. It is actually common for cluster sampling. But if we use here also, default will get 1.5. If we consider to increase the sample size, instead of 2, if you make it as 1.5, your sample size will be increased. Okay. But it is used, design effect we will use for only this thing. Okay, this option is there in adjustment. Adjust for clustering is there, no? That is design effect. So select there, design effect. Default, it will be 2. If you take it to 1.5, update, it has increased sample size to 400, almost double you got sample size. So when we get 1 in single decimal sample size, you can use this, but for cluster sampling it is actually. Cluster means different groups we take. Okay. So I think it is with the design effect adjustment. Then we will go to, this is manually we do apply design effect. So design effect, we multiply calculated sample size with design effect. Manually, if you want to do, 289 into 2 is design effect with 2. If you want to take 1.5, 289.1.5, that is with the design effect adjusted sample size. Okay, go to next slide. Okay. So this is next response rate. With response rate 10%, we can adjust the sample size. There we have option in statulator. If you want to calculate manually, this is the formula we use to calculate sample size with adjustment. So this is for response rate. 10% non-response means response rate is 90%. So we divide it by 0.90 to reduce the samples. So you can try this example in statulator as well as manually. There's no time to solve here again. So you take photocopy of this with your phone and you try it. Here we are considering prevalence proportion 63%, remaining margin of error and level of confidence are same. So this is another example. You can try, madam. All the participants can try with this. Okay. What prevalence from previous article, what we consider confidence level and margin of error. With all these, you first calculate manually and adjust for all things, and you also calculate with software. Okay. Now coming to comparison of two proportions. For two groups, analytical study, observational analytical study, how to calculate the sample size. So here we'll get from previous articles, we select previous article which is having two proportions. Comparative study only, similar articles we have to take, no? So from that, we will take P1 and P2. P1 is a proportion of first group, say control group. P2 is of cases group, okay? Here we consider power, okay? So usually we take 80%. To increase the sample size, we can increase the power to 85, 90, 95. And for alpha level, 95 confidence interval, we have fixed value as 1.96. Similarly, for power, we get fixed values. For 80%, it is 0.84. For 90%, it is 1.54. We have fixed values. If you search in Google, you will get it. So one more thing we will get here, alternative hypothesis. It asks, software will ask whether you want sample size with one-sided or two-sided. Do you know what is one-sided and two-sided in the hypothesis? Okay, one-sided means when we start to apply statistical test, we assume null hypothesis and alternative hypothesis. Always we assume in null hypothesis that there is no significant difference between two groups, and in alternative hypothesis, we assume there is a difference. When we consider alternative hypothesis that there is a significant difference between two groups, that is called two-sided. One-sided means group A is better than group B, or we consider in H1, group B is better than group A. So it is called one-sided. So usually we do sample size with two-sided. Okay. These are must to consider. Options are design effect, group size, response rate, and adjusted for continuity. Default, it is in formula as well as in software. Always it is yes. Continuity correction, always we consider yes. This is, we want to do a study, comparative study, the prevalence of hypertension in smokers and non-smokers in an urban area. Okay, so group 1 proportion is 30%, group 2 non-smokers is 15%. As usual, 95% confidence level, power we consider 80%. For 80%, Z beta is 0.84, and we decided to consider H1 as two-sided. So these are our assumed values. Comparison of two proportions. Okay, this is the formula we use to calculate manually. Okay, Z alpha, instead of alpha and beta, I have written A and B. Z alpha plus Z beta square into P1 into 1 minus P. If it is one group study, we take only P into 1 minus P. Here we are calculating two sample sizes. So it is P1 into 1 minus P1, P2 into 1 minus P2 divided by P1 minus P2 square. In one group study, we consider margin of error as 5 up to 5%. Here we take difference between two proportions and we consider power in the study. So by substituting all the assumed values, sample size is 170.5 or 180. So remember, the calculated sample size is per group. It is not total sample size. 118 into 2 is the total sample size. Excuse me. So it is total sample size is 236, per group it is 180. Okay. I think you can take photocopy of this, or you can search in Google also formula for two groups using proportions. So if you want to adjust for non-response rate 10%, so divide it by 0.9, means response rate is 90%. When we consider non-response rate, 10%, response rate will be 90%. So 0.90, calculated sample size divided by 0.90, that is 262. Or you can calculate 10% non-response rate, that is calculated sample size is 236 plus 10% of that is 24. If we add it to samples, calculated sample size, you will get the adjustment with response rate at 10%. So maximum you can consider up to 20%. Same sample size, adjustment with design effect. Okay. So we are comparing hypertensive prevalence in smokers and in non-smokers. So these are the given values. We default design effect will be 2. Now we are changing it to 1.5. So multiply with 1.5 to the calculated sample size. That is with the design effect 1.5, your sample size is 352.8 or 353. Okay. This is the example you can solve. Now we will solve previous example using statulator. So what we considered, P1 is 30 and P2 is 15%. Okay. So here, this is for one proportion. Now, two independent proportions, two groups, independent groups we are including in a study. So with two independent proportions, this is the window we get to enter the values. So expected outcome proportion in the reference group, we considered 0.30, no? So make it 30. Then second group is 0.15. Among non-smokers is 0.15. I adjusted it to 0.15. Okay. Then calculate. So 131 is sample size for each group. Okay. So total we get 262. So it has given write up as assuming 30% of the subjects in the reference population have the factor, or you can write here considering anticipated prevalence proportions of two groups as 30% and 15% of hypertension. After continuity correction, the study would require a sample size of 131 for each group. So if you consider equal size group, it will be 262. To achieve a power of 80%, to detect difference between two proportions at a two-sided p-value of 0.05. 0.05 means error is 0.05 means confidence level is 95%. So this is by default values we get as a 131. Then for adjustment to increase sample size, you can go to options. Here you can change the power by clicking on change, and default it is 80%. If you increase it to 85%, 90% or up to 99%, we can take the power. So by default, it will be, if we change it and update, our calculated sample size is with that much power. Okay. Some usually to reduce the beta error, we change the power. If you reduce alpha error, you can change the level of significance. 0.05 to 0.1 you can take, 0.2 you can take. Okay. Alternative hypothesis. Now, by default, it is two-sided. You can change it to one-sided also. Okay. So two-sided, you reset it to one-sided. When your alternative hypothesis, H1 is A greater than B, when you are confident that your group A is better than group B, then you can consider one-sided alternative hypothesis. Okay. Then group size also you can change. Now, by default, we are considering equal size in the two groups. First group 122, second group 122. You can change it as study group 120 and control group. We can get many controls, no? So we can change it to 1:2 ratio. 120 is the cases. 120 into 2 is, that is 240 is the controls. Sometimes to increase the power, we take 1:2, 1:3, okay, 1:1.5. So that can be changed, group size here. Okay. So update it. I have not changed anything here. All are default values are there. Update it. Now, adjustment for finite population or study design or response rate, that adjust is also there. Always, if continuity correction is selected, now we want to adjust for clustering two groups. That can be done with the design effect. By default, it is 2. I can take it as 1.5. So update it. Your sample size increases to 192 from 120. Okay. So again, go to adjust. So now adjust for response. It is not that we have to select anyone. We can adjust for clustering and then adjust for response rate. If you want to add non-response rate as 10%, you can do both, or you can select any one also. So you take 10% of that, update it, so it will increase the sample size. Okay. So I reset it for default results. Okay. So this is how we calculate sample size for two groups for qualitative type of study, that using proportions. If you have any doubts regarding this, you unmute and ask. Otherwise, we'll go to mean, quantitative type of study. Okay, no problem. Means no doubts. So manually, with design effect, I multiplied with 1.5. If you take 1.2, you multiply with 1.2 to that calculated sample size. So this is manually design effect. So this is example to solve you. Consider P1 as 0.25, P2 as 0.15. And as usual, confidence level 95%. Power, you can increase it to 90%. So your power value, when you increase it from 80 to 90%, it will be 1.28. For 80%, it is 0.84. Now it is 1.28. Design effect, you can adjust to any value. Non-response rate, you can take from 5% to 20%. So you calculate sample size using formula and as well as tabulate. So I calculated sample size using this two proportions, 331 multiplied by 2 is 662. Total sample size is 662. Per group it is 331. Change the design effect, reduce the sample size. Okay. So it is adjustment for design effect, adjustment with non-response, we get all these sample sizes. Okay. This is comparison of vaccine acceptance in urban and rural. Okay, same, you can try this also with the different power, different confidence level, different design effect. You check on the statulator with different values you can check. Manually, we can do only 1 or 2 times, changing the values. So use statulator and change the values. Be perfect, because how many times you can read, you see the YouTube or guest lecture, but we can't remember it for longer time unless and until you solve it yourself. Okay. So I'll go to next slide. Sample size using single mean. So this is the example. Here we have average blood pressure in adults. So objective is to estimate the mean systolic blood pressure in adults. So our objective of the study is mean systolic blood pressure among adults. Okay. So from previous study, we take a mean value of systolic blood pressure. Okay. And we take standard deviation also, because we use here standard deviation instead of mean. For one group study, we use standard deviation from the previous study. And margin of error, we decide up to 5%. If you take an absolute precision rate, and with the design effect, you try with 1.2 or any other values, and non-response rate 10%. Okay. Manually, if we solve it, formula for one sample is this one. So based on formula, that is Z alpha into sigma bracket square, or Z alpha square into sigma square. Sigma stands for standard deviation from the previous study. D square is again margin of error. Here we are from previous study, if standard deviation is 15 and we decided to take margin of error as 3%, then we take directly 3 square. So 96 or 97 is the sample size before any adjustment. Okay. I think it is clear. 4 PQ, no, like that, 4 SD square upon D square. The sigma we use to denote the population standard deviation. SD we use to denote the sample standard deviation. Here, previous study already published means we consider it as a population value. So in the formula, we denote standard deviation by sigma. Okay, so this is how we calculate using mean and standard deviation. So apply design effect 1.2. So 96 is the calculated sample size. We multiply by 1.2. It will be 150. And you can adjust it for 10% response rate. That is 90% response, not non-response. And calculated sample size divided by 0.9 is 128. So it has increased up to 30. Okay. So final sample size is 128. With 115 I calculated. See, here first I applied design effect. 96 is the actual sample size. When design effect I applied 1.2 times, it is 115. Then again, for 10% I added non-response. So it will finally, we get 128 as a sample size. If availability is not there, input of cases is not there, don't go for all these adjustments. Take directly only 96 as a sample size. So this you can calculate. This is the example to you. Mean daily calorie intake among teenagers. Standard deviation of mean and SRE they give. Usually in the previous article, along with mean plus or minus standard deviation we used to present. No? So that standard deviation you use to calculate the sample size. Okay. So you try it later. So without adjustments, we'll get 96, and with adjustments, we get finally 180 sample size. Okay. Excuse me, I will keep it in double later. Tomorrow I will keep it. Another half an hour it takes. That's okay. Thank you. So final sample size is 180 participants with all these design effect and non-response rate. Any doubts using formula? No? Okay, we'll continue. This is another example comparing the average BMI in males versus females. It is between two groups, between males and females, two groups, how to calculate. Before that, how to calculate sample size for one group for quantitative study or using mean and standard deviation discuss. Okay. So in the sample size menu, you go to means. Okay. For one group, estimate a mean. For two groups, compare two independent. For paired data before and after studies there, you select this one. Okay. Now with one standard deviation we are calculating. So we select this one. So level of confidence by default it is 95. Standard deviation 10. Precision or margin of error 1.5. Okay. So with this, if we calculate sample size, it is 174. So to decrease the sample size, we can take margin of error up to 5. So you increase it. So when you take 1.7, sample size will be 136. When you take 1.8, it has decreased to 122. So like this, up to 5 you can take here. So your sample size reduces to 90. So always with mean, when we calculate sample size, we get small sample sizes. So you can decrease the margin of error to increase the sample size. We increase it till we get desired sample size. Okay. So if I want only 100 or 90 to 100 sample size, till that I will decrease the error. Okay. So So 100 or 110. 100 we get with margin of error 2. So we'll consider margin of error 2 and we take this sample size. So assuming the expected population standard deviation, or from the previous study, the standard deviation is assuming 10, and that interest parameter we have to write, whether it is systolic mean standard deviation of marks or BP, that we have to mention here. And study would require a sample size of 100 with 95 confidence and 2% precision. Okay. So this is the description using mean. Okay. So again, adjustment is there here. Adjust for finite population. If you have total population, 600, you adjust it and update it. With 600, our sample size reduces to 86. Then again adjust, add. If it clustering also we can do, that is effect size we can do, but it is not clusters. We have only one group, we can leave also. Adjust for T distribution, it is default, you get it. Okay. So by default, it will be 1000. Update, your sample size will be 91 with all this. Okay. Reset it. This is how we calculate sample size for one group for quantitative study. We'll go to next one. This is how to calculate sample size for two groups. Okay. So we take mean as well as standard deviations from the previous study of two groups. Okay. This confidence level, power, again, we took here power because two group study it is. More than one group means we have to consider the power. But denominator, margin of error, we will not consider. That is the power, precision we get here. So design effect and non-response rate, these are adjustments we do. So this is by formula 2 into Z alpha into Z beta square into standard deviation square divided by mu1 minus mu2. Mu1 is mean of the first group, mu2 is mean of the second group, it's square. This sigma square, typing mistake, it has come here. It is not into, it is in the numerator. We have to multiply, but in the numerator only. Denominator is only difference between two means. Okay. So we calculate, I calculated here 2 into Z alpha we consider as 95%, it is 1.96. Z beta, it is 0.84 square into pooled sigma square, means standard deviation. We will get two mu and two standard deviations. No, you calculate average of that. That's called previous, means standard deviation from the previous study, sigma 1, sigma 2, and mu1 minus mu2. We get two means and two standard deviations. You can take their differences to calculate the sample size. So here I took 4 square divided by 4, this is 2 square. This is mean difference of the two means. Okay. So sample size is 62.72 or 63. This is without adjustment. So with adjustments, 1.3 design effect, sample size increased to 164. Adding 10% non-response, it will be 182. So per R, per group, it is 180. Total sample size is 182. That is 91 per group. Okay. Because here we took difference between two means and difference between two standard deviations. Okay. You try this example. Expected difference is 10 and standard deviation difference is 20. With power 90%, it will be 1.28. Sample size is 168.
Ma'am, I have one doubt, ma'am.
1 second. Using, I have not shown using the statulator for two groups. I will show it later. We'll discuss about about doubts. Now, sample size. We are calculating with means. Compare two independent means. Okay. So here we have two formulas. Expected means or expected difference between means. What I calculated is using expected difference between two means and difference between two standard deviation. If we select this, here difference you have to calculate, and between means and between standard deviations that you have to give. Okay, so suppose difference between two means is 10 and difference between two standard deviation is 15. Calculated sample size is 36 per group. Total is 70. So then again, options are there to increase the sample size by changing the power or level of significance. Okay, so to decrease the type 2 error, we increase power only. First, preference we give to power. It is like giving punishment to innocent person. Type 1 error is an error giving leaving a wrong person also. Okay. Type 2 error is giving punishment to innocent people who is not culprit of that event. Okay, so we decrease the type 2 error, so we change the power. Okay, so and the level of significance also changed. Then you change alternative hypothesis and group size also. If you want 1:1.5 cases and controls, okay, that options are there here. But finite population, effect size changes, all are there in the options. In the adjust for clustering. If we know sample size of each group, you can adjust for clustering. Okay, design effect we use there and we change it. We update, it has increased to 50. So individually 50 sizes we take per cluster, per group. Okay, so this is how we calculate using difference of means and difference of standard deviation. If we, instead of that, you can use expected means also. So here we give mean of two groups, but common standard deviation. Common standard deviation we give here. That is, add two standard deviations, divide it by 2. That is average standard deviation that can be used here. That is a mean difference we will not calculate. We give actual mean of two groups, pooled standard deviation, and calculate. It gives 50 because adjustment is there. Okay. 71. So in adjustments, design effect, intra-class correlation. If you know correlation value from the previous study, correlation means we denote it by R, no? Scatter diagram we draw, no? That is correlation coefficient. Sometimes we get correlation coefficient in the previous study that we use and calculate the sample size. Okay. If it is always correlation coefficient lies between 0.1 to 0.1. So in this, it is 0.2. By default, they have, we can change it if we know the, and cluster size, if we know, means if you want to take from each group what sample, that should be mentioned. That is using correlation coefficient. Okay. Or we can use design effect. So this is adjustment for power, options for increasing the level of significance or increasing the power. Adjustment is for design effect or correlation coefficient that we use. Okay. Even we can add manually 10% response rate to each group and 71 plus 7 in the first group, 71 plus 7 in the second. Okay. This is how we calculate sample size. for two groups using two means. Thank you for patience hearing. I tried my level best to show how to calculate manually as well as using software. Okay, if you have any doubts, you can ask.
Hello, ma'am. I have one doubt, ma'am.
Hello.
To get the exact desired sample size, how to decide, ma'am? Because we have seen many examples. Their sample sizes is varying depending on the margin error and the power. So how we come to know whether it only the researcher will decide the desired
Researcher
sample
only
size,
has to
or
decide. How means, see, in your hospital, you are including patients. So you are means you know, you will know how many patients visit to your hospital, means population size if you know. If input is not there in the hospital, so we consider 95% or 80% power. Will not increase it. But minimum that should be there. So researcher has to decide this power, confidence level, adjustments, all those things. And you calculate with the default values, 95 CI and power. If you feel it is small, you change adjustment you can do, or you can increase power, or you can increase level of significance to increase. But you can't decrease it because you already considered the correct means 95% CI and 80%. This much should be there in all sample size calculation. We cannot take 50% power, 70% power, or we cannot take 90% level of significance. So in that case, if you get large sample size with all these, you change your article because different studies get different answers. You change the parameter, second objective parameter you can take, or you can change the article and using those values, you can try to calculate the sample size.
Hello, ma'am.
Thank you so much.
Is margin of error is completely researcher's opinion, or should I have to take it from the previous study?
Margin of error, we will not take from the previous study. Result, that mean value, standard deviation, or proportions we take from the previous study. These researcher will decide.
Okay, so it is from 1 to 5, right?
Pardon?
It is from 1 to 5, right? Standard value
if
for.
you use absolute precision, it is 1 to 5.
Ma'am, but in there was a question that you gave us as an exercise, and it shows that the D is as 100. That is, the mean difference is 100. Margin of error is 100.
No, that is typo mistake it is.
Okay, it is a typing mistake, right?
Yeah.
Okay, ma'am, one more question. So for the definition of, for the formula of two proportions, is there any summation or plus sign there? Because while you are doing the manual calculation by putting the value, there was a summation, but in the formula there was in the summation sign.
No, Z alpha plus Z beta is there. But P into Q is, P1 into P2 is multiplication is there. P1 into 1 minus P1 into P2 into 1 minus P2.
Okay, ma'am, thank you. Thank you.
P1 and Q1 we multiply. We add that with other.
Okay, P1 and Q1. Okay, then again multiply that proportion with another P2 into Q2.
Yeah.
Okay.
P1 into Q1 plus P2 into Q2.
Okay. So but ma'am, I think in your slide there was P1 into Q1 into P2 into Q2.
I face difficulties in typing there because formulas, numerator and denominator, when we do it in a PPT slide, it is little bit difficult, what I felt. So we cannot copy and paste also, because if we copy and paste, we cannot do any adjustments. So I have inserted the some other formulas and I have written the values there. So might be some mistakes are there in there. But for formula, you search in Google, you will get correct formula, or you refer Mahajan book, B.K. Mahajan. For beginners, it is a good book. Many mistakes are there, but for beginners, it is a good book. All formulas are there with examples he has solved, taking medical field examples only. That is biostatistics. That's you refer Mahajan for formulas.
Am I audible?
Hello.
As you said that variables should be changed or parameters should be changed if we want to modify that sample size. Does the validity or reliability of test need, that means does it happen that change in reliability or validity change may need to change the sample size or parameters?
Sir, in calculation of sample size, you are asking?
If I am taking some parameter that is having some test, and the reliability or validity of test is having different, and that is affecting the sample size, where should I correct? Should I replace the test or should I modify the sample size?
Sir, where reliability comes, sir, here?
Among the parameters, if the parameter is some test and test having some reliability and validity.
Sir, you take it from the published article.
Okay.
Means it has reliability, what we consider. We consider them as a population value, generalized value. So it is already published means it has got all reliability, everything, sir. Reliability we check when we prepare a questionnaire to collect the information. If it is not standard one, used one, we have created the questions. Its reliability we have to check. In calculation of sample size, we take parameters from the previous time.
Suppose a test in review of literature, there is one parameter showing the reliability, something reliability, some number, and there is some another parameter in another article, and which is having different number in reliability. Then does it necessary to change the our preferred parameter, or we have to adjust the sample size? What is the preferred choice? What should be done?
If we are not satisfied with one proportion, one parameter of from one article, to change the sample size, I don't know whether I'm giving the correct answer for your question. What I understood, reliability means parameters, no, sir? What you are telling?
That reliability is for the test.
For the test, which test, sir? Statistical test?
No. For the test regarding that parameter. Okay.
Regarding the parameter only, no, sir?
Yeah.
Or,
yeah. No.
Okay.
That is not. That is unrelated to sample size. That is only related to the parameter.
Sir, here In calculation of sample size, no reliability will come, sir.
Okay, sir. Okay, thank you, madam.
Sir, I don't know whether I have given satisfied answer or not, because I am not understanding question correctly. Excuse me. Lecture hello, ನನಗೆ ಆಗುದಿಲ್ಲ ಇದೊಂದು ದಿನ ನಡೆದದು. ಹಾ, sorry. Hello, sir. I think I have not given correct answer.
No. I will try both way, and I will connect. That means I will contact with you. You have given that contact number and email ID. So I will check out the both way, and then I will ask you the precise question. Okay, thank you.
Okay, sir. Okay, sir. Anytime, sir. The slide, the first slide, my mail ID as well as I think phone number is there.
Yeah. You was having that. Thank you, madam.
I think, ma'am, sir is asking if for a same parameter we have a 2 articles.
Same parameters, 2 articles we have.
2 articles we have, and both are given different values for a same parameter, like standard deviation or a mean, whatever you take parameter, both are different. When we calculated the sample size on that parameters, then how to reliable whether our sample size is correct, whether I am getting it right or wrong, I don't know. That may be the question of sir.
See, madam, here already on diabetic, prevalence of diabetic, or take any example, already in many cities or in many hospitals, many researchers have done. Why again we do it? Because in our setup, we may get different answer. In their setup, the prevalence of hypertension is different. In our setup, because their lifestyle is different, say, for example, foreign, their lifestyle is different, food habit is different, everything is different. Their prevalence of any disease is different. So in our setup, we get different values, but parameter is same, prevalence of hypertension, prevalence of diabetic. But we get different answer in different studies. Means we can't say that this is wrong or this is correct or this is wrong, that is correct. No, we can't say, because all are correct. If we follow correct method, correct data, if they have collected and they calculated the prevalence, both are correct, because in our population, our prevalence is this much, and in their setup, that is different. So we can use different values from the different articles. Okay. For example, by applying ROC, we calculate sensitivity of the screening method or sensitivity of some method, and we give cutoff value. See, many studies, last 5 years back in our BLD college, we calculated cutoff value for some disease in dermatology department. And again, after 5 years, they took same topic, they calculated cutoff value is different. In 5 years back, staff has done it. I only analyzed that data. Cutoff value, what we got is different with this data set. Now, different, that professor has given to his PG that same topic again. Now, cutoff value with ROC curve only, same procedure I applied, but I got different cutoff value from this for the same disease. So it changes, madam. It changes on the different population. So previously what he has done, no, that is also correct. Now what PZ has done, that is also correct. We cannot say that he was wrong or now PZ is wrong. Correctly they have collected data and correctly they have done, but different cutoff value we got. So to change the sample size, we use different articles. So my PZs, when they come for sample size and PhD scholars, I tell them, take Indian article. If possible, published article are there in the Karnataka, take that one, recent one, because all status is changing. Prevalence is changing. Incidence is changing. So we can say that they are correct only. So we can use different articles to calculate sample size to change.
Okay, ma'am. Thank you so much, ma'am.
Am I right, madam? I don't know whether.
No, ma'am. Just I have a
Thank you.
doubt, and
Thank you,
I
madam.
thought sir is
Thank you,
also
madam.
having same doubt.
Yes, sir. Sir,
Yes,
sir.
thank you,
Yeah.
madam.
Oh.
Thank you, ma'am. Shall we conclude, ma'am?
Hello.
Hello. Shall we conclude, ma'am?
Yeah. Yeah.
Okay, ma'am. Now I request to Dr. Ravi sir to conclude the session with vote of thanks.
Thank you so much, ma'am. I would like to express our sincere gratitude to our today's esteemed guest speaker, Dr. Vijaya Sorganvi ma'am, for delivering a valuable contribution for sample calculation from her busy schedule and making this webinar a great success. Thank you so much, ma'am. I would like to thank to our Honorable Chairman, Sir, Dr. Shailendra Yadav, and Director, Madam, Dr. Sunita Yadav, ma'am, for being our backbone to this webinar. I thank to our beloved principal, Dr. Manjunath NS, sir. I also thank to our technical team, Dr. Nihar, sir, and Dr. Sinas, sir, for giving all the required technical things for this webinar. Lastly, I thanks to all the delegates for joining this webinar and making this webinar a grand success. Thank you once and all to everyone. Thank you.
Thank you so much, sir. Now the meeting is end. Thank you, one and all. Okay. There is one announcement that the recording of the session is available and that the YouTube link will be circulated through email IDs of all the participants. Thank you, one and all. Thank you so much, ma'am.
Thank you. Can I leave, madam?
Yes, madam. Thank you so much.
Thank you.